Welcome to my channel where we take big concepts like PTSD and medical trauma and break them down into bite-sized pieces for both professionals and people who've experienced it. Have you ever heard someone say medical trauma or medical PTSD? Some people might have the response that everything is traumatic these days, so nothing is trauma and everyone's too sensitive. But we are going to shed some light on this sensitive topic so that I can help support your healing journey or that you can support someone else. I'm Dr. Chrissy Elrod. I'm a licensed therapist and a university professor. And as a therapist with 15 years of experience and a life experience of a breast cancer survivor, I'm here to support your healing journey. Medical trauma is the psychological and emotional distress that you experience after or even during medical events. It encompasses various experiences like surgeries, treatments, chronic illnesses, accidents, any of those things that have to do with interacting with a medical setting. There are a lot of different experiences related to illness, injury, or medical treatment that can be difficult or uncomfortable. Could be a sudden life-threatening illness or injury and the related treatment that goes along with it, like a car accident and waking up in the ICU. It could be the shock and feeling of being out of control when you get a scary diagnosis, or a life-changing complication or problem during or after a typical medical procedure like a childbirth. There might also be unexpected medical interventions such as needing an emergency surgery or needing an emergency intervention, which happened to me when I was having my breast cancer treatment. This journey can be really overwhelming, and it's essential to acknowledge the depths of emotions that can arise here. After medical trauma, it's common to experience a range of symptoms and side effects. Emotions might look like fear, anxiety, sadness, anger, guilt. All of that is normal to experience. You might also find yourself replaying the events in your mind, feeling triggered by certain sights or sounds or smells. Definitely happened to me. Remember, these responses are normal responses to an extraordinary, unusual situation. You're not alone on this path. So many women who have gone through medical trauma have faced similar challenges. Sharing our stories is really what's going to foster connection and provide a sense of validation. I don't share all the details of my story in this particular video. I spread them all around the internet on my Substack or on other videos because I want you to know that I've also navigated the waves of medical trauma. I understand the complexities that it brings, and I'm trying to unravel all of this for myself while giving something to you so that hopefully we all learn together. Remember, if you struggle from medical trauma or PTSD, reaching out for help is a sign of support and strength and not weakness. There's no shame in asking for help when you need it. So if you're ready to delve deeper into understanding healing from medical trauma, I invite you to visit my Substack where you'll find valuable resources, uplifting stories, and a very compassionate community. If you have questions that you want me to answer, place them below. I love talking about medical trauma and I love learning and sharing what I know with other people.